Mode of cancer transmission. In other words, how can someone contract cancer or get infected by cancer? Cancer is not a contagious disease, meaning it cannot be transmitted from person to person through normal contact, like hugging, touching, or sharing food. However, there are some specific situations where elements related to cancer can be transmitted, typically involving viruses or rare medical cases. 1. Not transmissible, general cancer. Cancer itself does not spread between people. You cannot catch cancer from someone who has it. 2. Virus-associated cancer, infectious agents. Some viruses and bacteria that can lead to cancer are transmissible, but not the cancer itself. Infectious agent transmission mode. Linked cancers. HPV, human papillomavirus. Sexual contact cervical, throat, anal cancers. Hepatitis B and C. Blood, sexual contact. Liver cancer. H. pylori, bacterium. Oral, fecal oral. Stomach cancer. EBV, Epstein-Barr virus. Saliva lymphomas, nasopharyngeal cancer. HIV blood, sexual contact. Increases risk of Kaposi sarcoma, lymphomas. So while these infections can be transmitted, they only increase cancer risk. They do not directly give someone cancer. 3. Rare medical exceptions. Organ or tissue transplants. Very rare cases where cancer cells have been transmitted from donor to recipient, especially if the recipient's immune system is suppressed. During pregnancy, extremely rare transmission of cancer cells from mother to fetus, fewer than 20 cases reported. Laboratory accidents. Extremely rare cases where cancer cells accidentally implanted in lab workers. Summary. Cancer itself is not contagious. Some infections that can lead to cancer are transmissible and preventable with vaccines, like HPV and hepatitis B. Rare medical scenarios exist, but are not a public health concern for the general population. Incubation period of cancer. The incubation period of cancer refers to the time between exposure to a carcinogen or risk factor and the appearance of detectable cancer, is highly variable and can range from years to decades. Unlike infectious diseases, cancer doesn't have a fixed or clearly defined incubation period because of the complex process of cellular damage and mutation. Key points about cancer incubation period. 1. Long and variable timeline. Most cancers take 5 to 40 years to develop after exposure to a carcinogen. Example, lung cancer may develop 20 to 30 years after a person starts smoking. Mesothelioma, linked to asbestos, can appear 30 to 50 years after exposure. 2. Influencing factors. The length of the incubation period depends on type of cancer, strength and duration of exposure to a carcinogen, genetic susceptibility, immune system function, age at exposure. 3. Silent progression. Cancer often develops silently without symptoms for many years. Precancerous changes may occur long before diagnosis, e.g., polyps in the colon. Examples by type. Cancer. Type common cause. Typical incubation period. Lung cancer, tobacco smoke, 10-30 years. Mesothelioma, asbestos, 20-50 years. Liver cancer, chronic hepatitis, BC, 20-30 years. Cervical cancer, HPV infection, 10 to 20 years. Skin cancer, melanoma, UV radiation, 10-40 years. Summary. Cancer has a long, unpredictable incubation period. It involves gradual accumulation of genetic mutations. Early detection through screening, e.g., mammograms, colonoscopies, Pap tests, is crucial because symptoms may not appear until late stages.